When a donor organ becomes available, one of our 5 liver surgeons reviews the information about the donor and decides if we think that it is a suitable liver for you. Who performs your liver transplant is based on a rotation or call schedule. You will meet your liver surgeon on the day of your operation. If the donor is a good match for you on paper, the team will call you and ask that you come to the hospital in Detroit to prepare for transplant. While you are making your way to us, a team will go to evaluate the liver in person and perform the operation on the donor to get the liver. One of the important things for success in liver transplant is that the liver is outside the body for the shortest period of time. So it is very important that we are ready to start your operation as soon as the team confirms that the liver is usable. However, there is always a chance that when the team evaluates the liver, they will not think that it is suitable for transplant. These false starts can be disappointing, but they are necessary in order to ensure that you are ready to go when the organ is usable. If everything looks okay with the donor liver and you are in acceptable condition for liver transplant, then we make the decision to go ahead with the operation. The liver transplant operation takes about 6 to 8 hours. After putting you to sleep and placing special IVs to monitor and care for you during the operation, the first part of the operation is to remove the entire liver and the gallbladder. Even in situations where you may be receiving a part of a donor liver, your entire liver will be removed. The second part of the operation is putting in the new liver. When we put in the new liver, we make 4 connections between your body and the new liver. The 4 connections we make to the new liver reflect the liver functions. 3 of the new connections, labeled here as 1, 2, and 3, bring blood into the liver and out of the liver and back to your heart. The 4th connection connects the liver to the intestine. This allows for digestive fluid called bile that is made in the liver to flow into the intestine. We generally use 2 types of incisions for surgery. Which incision is used is based on the shape of your belly and ensures that we have enough space to perform the operation. Surgical drains will be placed at the time of your surgery. These drains collect fluid from the belly and help us to assess how things are healing on the inside, based on the color and the amount of fluid. Generally, these can be removed in your hospital room prior to leaving the hospital. After the transplant operation, you will be taken directly to the intensive care unit. In about half of our patients, the breathing tube placed at the beginning of surgery will be removed immediately at the end. In patients where the breathing tube needs to remain in, it is usually able to be removed within the first 12 to 24 hours after surgery. If the breathing tube remains in, you will be given medications to keep you comfortable while it is in place. The ICU stay is typically about 1 to 3 days. When you are stable to leave the intensive care unit, you will be transferred to the transplant unit in the hospital. All of our patients recover in the same unit, and we have an amazing team of nurses and other care providers with experience taking care of post-transplant patients that will assist you with your recovery. The average length of stay in the hospital is 9 days. When you are medically ready to leave the hospital, you will either go straight to home or to a rehab facility. The physical therapy team will help assess where is best for you to go. When you go home, you will need a support person to help you while you recover. We ask that you do not stay alone for about a month. This is not because you will need to be weighted on hand and foot, but you may need assistance with mobility, medications, mood, and transportation. We recommend that you have several people who can support you in this role. If, when you're otherwise medically ready to leave the hospital, you are not quite ready to go home from a strength and stamina standpoint, then you may go to a rehab facility for a period of time before you transition to home. After leaving the hospital, you will be seen frequently in our clinic and have your blood drawn to assess the recovery of your liver and to make sure that you have the right amount of anti-rejection medication in your body. These visits are initially 1 to 2 times a week and are transitioned to less frequent as your recovery stabilizes.